Hello, my name is Dara, and today we'll be talking about thoracic outlet syndrome. My name is Dara Nwaka. I'm a registered vascular technologist and diagnostic medical sonographer. For further readings, you can purchase my book on Amazon, Vascular Technology Made Simple. Again, this book helps to simplify the complexities in vascular. And also the topic I am discussing today also can be found in my book in more details as well. At the end of the webinar today, participants will be able to identify types of thoracic outlet syndrome, describe how to image thoracic outlet syndrome, recognize normal and abnormal results. What is thoracic outlet syndrome? It is the compression of the following by the rib, clavicle, or muscle. Thoracic outlet syndrome is the compression of the brachial plexus or subclavian artery or vein. This syndrome is either congenital or acquired. Some people are born with this condition, and some people over the years develop thoracic outlet syndrome. Signs and symptoms. Clinical symptoms are usually dependent on the structure being compressed and significance of compression. Neurogenic thoracic outlet syndrome. This occurs in 90 to 95% of the cases. It is the compression of the brachial plexus. Symptoms of this type of thoracic outlet syndrome includes paresthesia and numbness of the upper limb. Now you have the venous thoracic outlet syndrome. This is less common as compared to neurogenic compression. It is the result of a subclavian vein compression. Symptoms of this type of thoracic outlet syndrome includes upper limb swelling, pain, and can result to venous thrombosis. Venous compression can be sometimes intermittent without venous thrombosis. Now you have the arterial thoracic outlet syndrome. This occurs in less than 3% of positive cases, the rarest of all three compressions. Symptoms include ischemia with coolness, pallor, paresthesia, decreased upper limb pulses. Due to the compression of the subclavian artery, the artery is damaged at the level of the first rib. Thus, the damaged artery results in the occurrence of distal embolism. So in cases where you have patients with arterial thoracic outlet syndrome, if they do embolize to the distal digits, you would happen to see some blue fingers, discoloration in the fingers. So what are the indications for thoracic outlet syndrome? You have neck pain, shoulder pain, arm pain, numbness, tingling, weakness, cold hands, and discoloration. So how do you image for thoracic outlet syndrome? You want to obtain waveforms with patient in a neutral position. Patient could be sitting up in a stretcher or in a chair. You want to attach PPG to the index finger or obtain continuous wave Doppler of the radial artery. You want to perform some or all the following provocative maneuvers. There are different types of maneuvers. As I researched for this webinar here, I realized there's a lot more positions used to rule out thoracic outlet syndrome. And here you have the Adson, you have the Roos, you have the Allen's test, you have the military, and then position that triggers patient symptoms. There's also the 90-degree, the 180-degree position. There are different types of positions, so you want to make sure that you follow the position identified or requested by your department. Imaging for thoracic outlet syndrome continue. You want to observe for changes in the PPG waveforms, maintenance of waveforms normal, or diminish in PPG waveforms, which is abnormal. So as you have this patient in different maneuvers, the first thing you want to do is just watch out for changes in waveforms. The Adson maneuvers, and you can see that image to the right side with the physician positioning the patient into this position to possibly see if he can trigger the symptoms of this patient. So here you have patient is seated, head is rotated and extended to and from the affected side. Patient is instructed to take and hold a deep breath. The affected arm is then abducted with the elbow flexed. Examiner feels for absent or weakened radial pulses. In our case, when imaging the patient, you want to observe for changes in PPG, maintenance or waveforms, or changes in waveforms when you have the patient in this position. This is the Roos test. You can see that image to the right side. This is the most accurate for the diagnosis of thoracic outlet syndrome. Patient is seated up, arms at 90 degrees, external rotation and elbow flexed to 90 degrees. Head remains in neutral position. Hands are open and closed for 3 minutes. So you can see the arrows there in her hands. The patient would be asked to open and close for 3 minutes. You want to observe again for changes in PPG waveforms. You want to see if the waveforms remain normal or if the waveforms diminish during this process. Now you have the Allen's test, which is a neurovascular compression. Patient is seated also, as you can see in this image to the right, shoulder abducted to 90 degrees, elbow flexed to 90 degrees. Patient is instructed to turn head away from the affected site. And you want to observe for changes in PPG waveforms, maintenance of waveforms, and diminish in PPG waveforms as well. In this image here, you have the military, also known as the Costoclavicular Brace test. This test is done on patient with symptoms when carrying a backpack. So this patient will complain of pain when they're carrying something heavy on their back. Test performed with patient standing. Have patient pull shoulder down and backwards. In the image here to the right, the patient was sitting, but as you can see, the patient is sitting very upright for this test. So you want to have patient push shoulder back and backwards. Have them taking a deep breath. Again, you want to observe for changes in PPG waveforms, maintenance of waveforms, and or diminish in PPG waveforms. And then finally, you want to have the patient in a position that triggers their problem, that triggers the symptom. So you want to ask patient what position triggers the symptoms you're having. You want to have patient position themselves to the triggering position. You want to observe again for changes in PPG waveforms, maintenance of waveforms, and diminish in PPG waveforms. I also want you to note that the positions that I discussed in this webinar, it's not set in stone. There are so many various positions used to rule out thoracic outlet syndrome. I know in most labs we use the Adson, we use the 80 degree, we use the 90 degree, and we use the military position. But also some of these positions also have names attached to them as well. So again, you want to make sure that you are very aware of the position used in your vascular lab, which would help you properly treat this patient or / identify the problem. Abnormal results in a patient with thoracic outlet syndrome. This is an image obtained from the St. Luke's Medical Center, Global City. And you can see on this patient, when you look at the waveforms to the right as compared to the left side, you can see significant changes in waveforms in this patient. The first one was the patient in a regular sitting position. And when you have this patient in that position, you are able to see that there was not much of a change in waveforms. As the patient, the second one, you have patient in 90 degrees and the patient in 180 degrees, and patient was in the costoclavicular position, the Adson, and also the symptomatic position. You can see as this patient went through different maneuvers, patients definitely showed positive for thoracic outlet syndrome. And when you look at the right side, you can see waveforms were maintained throughout these maneuvers. So again, you want to make sure you have your patient in that position. You want to make sure that you properly perform the maneuvers, which would help identify the problem. Thank you so much for listening this with me today. Feel free to message me at info@divinescanning.com if you have any questions for me. Also, if you need further readings and if you have further questions, or you need, better understanding of what I discussed today or what I've discussed in my previous webinars, feel free to get the book on Amazon, www.amazon.com. When you type my name, Darren Owaka, the book should pop up for you. Vascular Technology Made Simple. If you're looking for CMEs as well, feel free to get into some of the CME courses that I do have posted online. Thank you and have a good day.